Hello, future nurses. Welcome back to our channel. Today we are learning epilepsy in a very easy and interactive way. So get your notebook ready. Let's understand epilepsy in just a few minutes. Definition: epilepsy is a chronic neurological disorder in which a person has repeated, unprovoked seizures. Seizures happen because of abnormal electrical activity in the brain. Simple words: brain signals misfire, sudden abnormal movements, sensations, or loss of consciousness. 2. Causes of epilepsy. There are many causes. Remember this easy mnemonic: THIMT. Let's break it down. Trauma, head injury, accidents. Hypoxia, less oxygen during birth or drowning. Infections, meningitis, encephalitis. Imbalance, metabolic, low sugar, low sodium, kidney failure. Malformations, birth defects, genetic issues. Tumors, brain tumors, stroke. Pathophysiology, simple explanation. In a normal brain, electrical signals move smoothly. But in epilepsy, neurons start firing very fast. They spread this abnormal energy, causing temporary changes in movement, behavior, consciousness, and sensation. Like when a light bulb flickers rapidly. Same thing happens in the brain. Types of seizures. 2 main types. Remember, GF, generalized and focal. A, generalized seizures, whole brain. 1. Tonic-clonic, most common. Person falls, body stiffens, tonic. Jerking movements, clonic. 2. Absence seizure, few seconds, blank stare, no response, mostly in children. 3. Myoclonic, sudden jerks of muscles. B. Focal seizures, one part of brain. 1. Simple focal, patient remains aware, tingling, strange smell, twitching. 2. Complex focal, impaired awareness, lip smacking, staring, confusion. Page 5. Signs and symptoms. You can remember with mnemonic starts as sudden jerking, temporary confusion, aura before seizure, strange smell, taste, dizziness, rigid body, tremors, unconsciousness, sudden fall. 6. Diagnostic tests. The doctor will perform EEG, most important, checks brain electrical activity, MRI/CT scan, tumor or brain injury. Blood tests, electrolytes, sugar level. Medical treatment. Epilepsy is treatable. Let's see how. 1. Anti-seizure medications, phenytoin, valproate, carbamazepine, levetiracetam. 2. Surgery, if medicines don't work. 3. Ketogenic diet, high fat, low carbs, helps in children. 4. Vagus nerve stimulation. Page 8. Nursing management. Host, this is the most important part for exams. Remember the mnemonic, SAFE, for seizure care. A. During seizure, safe. Stay with the patient. Keep calm. A. Airway open. Turn head to one side. F. Free surroundings. Remove dangerous objects. E. Ease the fall. Put soft padding under head. Do not put anything in patient's mouth. Do not hold them tightly. Do not give food/medicine during seizure. B. After seizure, check airway, breathing, circulation. Note duration and type of seizure. Keep patient in side-lying position. Check vitals. Provide reassurance. Document everything. 9. Patient education. Take medicines on time. Avoid flashing lights. Get enough sleep. Avoid alcohol. Wear medical alert bracelet. Families should know first aid step. And that's it, nurses. You learned epilepsy easily with mnemonics and simple explanations. If you want more nursing topics, comment below. Don't forget to like, share, and subscribe. See you in the next video.